Hi everyone. For my assignment, I interviewed a nurse named Katie who works at Riverside Methodist Hospital here in Ohio. And for the first question, I asked her if EBP is clearly stated in her organization's mission, and she said yes and no. She said that the mission of Ohio Health is to improve the health of those we serve, and she thinks that EBP is integrated into that because the best way to improve the health of those we serve is through utilizing EBP. So she would argue that that can only best be achieved through EBP, so it technically is part of the mission statement, but it's not explicitly written. For the second question about what Katie would do if she had a clinical inquiry or something she was wondering about, who her EBP mentor is, and the EBP committee and who oversees the committee, she said that in her practice, they have 2 to 3 physicians designated as head of her education committee, whose goal is to provide physicians and APP with continuing medical education. So she said that she would go to them with a clinical inquiry. She said that her ABP mentor would probably be the head APP, and she said that she honestly isn't sure who the EBP committee at the hospital consists of or who oversees them. For the nurse scientists, if she needed to speak with them, where would she find them? She said that there's an office on her floor that consists of different people that come in and out each week that all have expertise in evidence-based practice, and that they're all located in the office, and she kind of considers those people with the role of the nurse scientist. So she has that resource to utilize on the floor. But she also said that she goes to her lead nurse practitioner with issues like these as well, and sometimes her lead nurse practitioner directs her in the direction of someone who can answer this type of related question. When I asked her about if her organization's nurse scientist understands the EBP process and what type of formal education they've had on EBP, she said the people that are in that office that I mentioned all have gone to several EBP seminars and retreats to specialize in that area of nursing. And she said they all have tons of resources that they direct in her way all the time and to other nurses on the floor. As a clinician, where do you find the point of care EBP resources? And she said the EBP point team at her hospital send out weekly PowerPoints of education points via email. They're also cataloged on her app for easy reference, and they re-record and record presentations that nurses can listen to at any moment. The organization's library and 24-hour access, she said that they have education materials that are available 24/7 on their app. Her practice also pays for UpToDate Database, which is a search engine on condensed evidence based on any topic in medicine. They also have 24/7 access to Ohio Health databases, and this consists of things like empiric antibiotic guides and the best practice data. Mentors for EBP in her organization are in that office that she mentioned that's on her floor. And if she needed to explore bringing an EBP initiative forward, who could she present this to? She said that she would present this to the head nurse on her floor or the mentor and committee groups that she's previously mentioned. When I asked if she feels like your leadership supports you in EBP and if they help navigate barrier to implementing EBP, she said, yes, we are provided an allowance for CME money to spend on conferences and resources to help us continue to stay up to date on EBP. And she said if there are barriers to implementing, we will use multidisciplinary teams, including physician-driven teams, nursing leadership-driven teams to solve the problem. When I asked how her organization recognizes EBP initiatives, teams, and champions, she said the physicians that are part of an education committee above are compensated to teach lectures and make PowerPoints to teach the rest of us. And when I asked if she feels like nurses, physicians, allied health clinicians, and leaders use EBP in their daily practice, she said absolutely. She said she thinks and uses EBP anytime she's treating patients every day. She said whether they're a new patient or if they're a patient she rounds on for the day, she said she uses it in each thing that she does. She said her practice also adds money to their bonuses based on how many of the lectures they attend for EBP, which is incentives for people to attend. To reflect on this, I would say this was easy to find someone to assist me in my initiative because I know Katie pretty well. She's my best friend's older sister, and I was surprised that she didn't know a ton about the EBP committee in her hospital, and I was also surprised that she didn't know a ton about her nurse scientist on her floor. If I can improve one thing about the organization, I would say that they need to have an EBP committee that's easier to access and find, And I think that would change things because people could access more specific EBP resources. And also the nurse scientist needs to be known by all nurses that work there so they can ask her questions whenever they need to. Thank you.